Hello, welcome back to the Cyrex Labs education series. This is video number 3. I am Robyn Puglia. I am the head of practitioner education and support for Cyrex Labs for the UK, Europe, and Ireland, and a consultant for Regeneris Labs. And in this video, I am going to do just a very quick overview of the entire test suite. Um, so To develop an autoimmune disease in the first place, it is widely considered that you need to have 3 variables in place. There needs to be a genetic predisposition, there needs to be an environmental trigger or layering of triggers, and there also needs to be barrier permeability of some kind. So with autoimmunity, we tend to talk about intestinal permeability as being the primary immune barrier involved, but in fact, there are multiple mucosal and immune barriers in the body. And damage to those barriers and breach of those mucosal or immune barriers doesn't just predispose or isn't just involved at the initiation of autoimmune disease. If you have an established autoimmune disease and you still have barrier permeability, then that will continue to exacerbate immune system instability, inflammation, and perturbation, and it actually changes the prognosis of the journey of the person that you're working with. So whether or not you are trying to work out if somebody has got an autoimmune disease or if they have an established autoimmune disease that is multiple years or even decades post-diagnosis, assessing and understanding the immune barriers is an important part of assessment at the beginning of your work together, and also at intervals through the work that you do if there was permeability involved at the first assessment. So Cyrex has got 3 tests that really fundamentally focus on barrier permeability. We have Array2 and Array22. So Array2 is an assessment of the tight junctions and of the intestine, of the gut. And Array22 is an assessment of autoimmunity against the adherens junctions of the guts, specifically related to infection or SIBO. So we have 2 tests that look at permeability or destruction of the gut wall or gut wall integrity. And then we also have Array20, which is an assessment of the blood-brain barrier. Additionally, we do a mucosal immune assessment in Array14, which is a salivary panel, and I'll discuss that separately. So remember, one of the 3 variables of the development and progression of autoimmune disease is the environmental triggers. There are 4 categories of environmental trigger. We have foods, infections, toxins, and HPA axis dysregulation / stress / trauma. Now, we don't make antibodies for stress, and so they're not part of Cyrex's testing suite. However, we do have a very comprehensive series of tests which allow you to really understand the role of the environment, not just in the development of autoimmune disease, but also in the continuation of autoimmunity or immune system dysregulation with the clients and patients that you're working with. So we have 3, 4, 10, and 10x, which really allow us an in-depth analysis of foods and food proteins, assessment of oral tolerance, and assessment of those foods as a specific driver of autoimmunity and immune system dysregulation. We have Array11, which is a chemical immune reactivity panel, Array12, which is a pathogen-associated immune reactivity panel, and it is the only comprehensive pathogen panel that I know of that really looks at all of the different types of microbes, bacteria, yeasts, molds, oral pathogens, gut pathogens, airway pathogens in one place. And so it's very comprehensive, and all of the pathogens that are directly associated with autoimmune disease, or most strongly associated with autoimmune disease. And then as part of our pathogen assessment, we also have the biome burden panel, which looks at the fungal burden of the body and the role of various different fungal species and also fungal biofilm in the development and perpetuation of autoimmune disease and chronic immune system dysregulation. So that's our environmental trigger panel suite. A hallmark of autoimmune disease is autoantibodies. And so, of course, Cyrex has multiple panels that help us to assess the presence of autoantibodies in our client and patient population. So the most comprehensive test that we have is Array5, which is our predictive antibody panel, multiple autoimmune reactivity screen. This looks at the most common tissue-specific autoantibodies in order that we can assess whether or not this client or patient is autoimmune, whether they have any of the most common tissue-specific autoimmune diseases, or if they have a diagnosis of autoimmunity, it's helping us to understand if they have any additional autoimmune diseases, either in the developing stages or that haven't been diagnosed but are present in the body. And additionally, it really helps us to assess tolerance, the relationship of the immune system to tolerance of tissue, because sometimes that is also a wider lens view of the immune system for somebody with autoimmune disease. Array7X is a subset of Array5. So 7X is just looking at the neurological autoantibodies. So all of the neurological markers on 7X are on Array5. Array5 is an extended panel that includes Array7. However, 7X also, so 7X also looks at IgM antibodies, so these neurological markers. So it is more appropriate if somebody has a recent injury or if they have recent onset symptoms, and we need to understand the IgM immunology associated with neurological autoimmunity. The reason that that's important is because it allows us for the earliest assessment of developing neurological autoimmunity. And I will discuss that when in the video that really just dives into Array7 by itself. There are tissue antibodies also found on Array3. So Array3 is our gluten and wheat reactivity profile, and it's appropriate to include in a gluten reactivity profile the gluten-related autoantibodies. So there are 3 tissue transglutaminase antibodies found on Array3X, tissue transglutaminase 2, which is associated with celiac disease and is the hallmark autoantibody for celiac disease. Then we have transglutaminase 3, which is associated with gluten-reactive skin autoimmunity, including dermatitis herpetiformis. And then we have transglutaminase 6, which is associated with gluten-reactive neurological autoimmunity, including gluten ataxia. In Array14, which is our mucosal immune reactivity screen, there are autoantibodies looking at gut-specific and enteric nervous system tissues. And then in the Alzheimer's links panel, we are doing a deep dive into the immunology of cognitive decline. So there are multiple autoantibodies there associated with dementia, Alzheimer's disease, and the neurology of cognitive decline. So Array14, which is our mucosal immune reactivity screen, is a standalone panel. It is a salivary panel, salivary immunoglobulin panel. So it's looking at secretory IgA and secretory IgM. The other antibody panels that I've mentioned thus far are serum antibodies. So they're assessing the systemic circulation. The systemic immune system. So the mucosal immune system is an independent but interconnected branch of the immune system. It functions independently to the systemic immune system. And so we see markers in the mucosal responses earlier than we see them in the systemic responses, but they are also independent. So sometimes we will see them in the earliest state of reactivity in the mucosal immune system before they are established in the systemic immune system. But we can also have responses on the mucosal surface that we aren't having systemically and vice versa. So Array14 has 25 different antigens. It is a salivary panel, and we're looking to understand foods, toxins, infections, and autoantibodies on the mucosal surface of the gut specifically. Our Alzheimer's links panel is a cognitive health panel, and it's helping us to identify as early as we possibly can the key environmental and internal factors which contribute to cognitive decline. So it is one of our broadest range. It is one of our panels that has the broadest range of antigen types in one panel because we're looking at foods, infections, toxins, and autoantibodies all in a single panel, including the antibodies to the neurological tissue and then all of the different environmental triggers that cross-react with those antibodies, giving us a really comprehensive assessment for the development of cognitive decline. And lastly, we also have total immunoglobulins. This is also called the GAM panel. So it is an assessment of total IgG, total IgM, and total IgA. This test can be run independently or alongside any of the other panels. And it's important to understand that anybody with a chronic inflammatory or autoimmune condition can naturally have suppressions or elevations of any or all of the antibodies, IgG, IgA, and IgM, as a feature of their illness or of their immune system dysregulation. But this also helps us to assess immune response in a patient who has been taking any type of prescribed or over-the-counter medicine that has the ability to affect the immune system. And the reason that we want to do this assessment is because the majority of our tests and our test suite, we're using antibodies to as a way of assessing the immune response. And so it's important to understand the context of those antibodies. This isn't just true for the Cyrex panels. Understanding whether or not somebody has elevated or low IgA, IgG, or IgM will help with appropriate assessment of any panel, conventional or functional, that relies on antibodies for the test results. So other infection panels, other food reactivity panels as well. So we actually learn a lot about the immune system and about the context through which we can view the immune system with this very simple panel. And so I recommend running it alongside the Cyrex panels that you order. Okay, thank you so much for your attention. Now I'm going to be doing a video on each of the panels so that we can learn a little bit more about the analytes that are included and the clinical applicability of each of the tests. Thank you so much for your attention.